We are not a big corporation or machine production line type of plastic surgical office. This is a very intimate, small setting. We really have focused on making sure that the moment a patient calls, that first contact is the moment that a patient is compelled to visit with us. The moment they get an email, the moment they call the office, the moment they talk to me or talk to any one of my staff. We want them to genuinely know that they are absolutely the most important reason that we are here. And we carry that philosophy on from the moment they walk through the door, from the moment they see Denise, from the moment they see me, from the moment they have their surgery, and the entire visits afterwards that involves extensive follow-up that really complete a picture that say we're about you not just before your procedure's done, but afterwards as well. It's essential that we know patients personally and individually because each patient is unique. Surgery is more than just simply taking a knife to someone. It really involves understanding what their needs are, what their desires are, and really focusing in on what it is that's important to them and addressing their concerns, and then being able to really explain to them what it is that we can and can't provide to them. I mean, there are some patients that do come to visit with us that really are not good candidates for plastic or cosmetic surgery. And it's important for us, it's our responsibility, really to create a win-win situation here. And that does sometimes mean that we can't provide a service. But most of the time, it really allows us to, from the moment they come in, and each of us get to know this person, and not only at the first visit, but in many situations bringing them back before the surgery, so they've had time to think about what it is that they're really interested in, that they've had time to consider and contemplate what it is that we've talked about, and if there are any other questions that they may have, any other concerns that they have that we can address. By the time this whole process is completed, we have really thoroughly had an opportunity to really get to know each other. They absolutely have to get to know me. There are a lot of good plastic surgeons, there's no question about that, but this becomes a very personal thing. They need to come and say, I want you because you're unique, and we connected. And above and beyond meeting the criteria and the certification and all the credentialing, there's something that transcends that. And I think that that's why our practice has developed and grown, is because I think that patients have experienced a very personalized touch that my staff and myself really strive to provide. I think that that's where, for example, Denise and Janet and Jennifer come in really in setting the tone. They've had an opportunity to speak with each patient and greet them, and they've already had a number of phone calls with them before they've even come in. And in many cases, they've already come in for a consult with Denise, just to be introduced to the practice. So they feel much more comfortable about being here, and by the time they meet me, they're much more relaxed, I think, than coming in just fresh and having had no exposure to our practice. And I think that really is helpful. By the time we sit down, it's a matter of just, I think, getting to really introduce ourselves and just talking a little bit, and then finding out, all right, what brings you here? Tell me your story. And it's not uncommon for many patients to really start talking, opening up. And Denise is always kind of on my case. Dr. Kayser, you've run over. We got to stop. So that's okay. You know, they feel comfortable, and it's good for them to feel like they can open up and feel comfortable with me. There are for example, patients that come in who's, interestingly enough, tell me stories of their personal lives. One that comes to mind right now is their adoption of their children, and I instantly relate because so were mine. And I can empathize and share their story with them. And part of what this is about is also really kind of relating on a very personal, human level in a way that says, you know what, I've been there, I know. And really, I think that allows patients to realize that we're not just about saying, okay, next kind of thing. This becomes a very personal thing, and we do share stories. We share stories with each other. And it can be, to some patients, very emotional. There are a lot of patients who come in, for example, struggling with weight. And that's a difficult journey. And there often can be a lot of baggage with that. But there's also a lot of encouragement because I have a lot of patients who have also shared their story of when their journey has led them to successfully losing a lot of weight in a way that has been a result of fundamentally changing their lives. And that's a powerful story. And, you know, that the ability to empathize with one patient and hear the story of one patient has really allowed me to carry that in my own life and then share that with others. I have countless photographs of patients who have been part of my practice, and by the time they've actually been here, they've already been on my website, and they've had an opportunity to experience and view many of the photographs that I have. Plastic surgery is a very visual profession. It's also a profession in which patients have an expectation for an immediate result. And that actually is good because they get that immediate result. Now, the reality is that, of course, they have to be informed that healing takes months and months and months. So sometimes there's some impatience. But I also am clear about showing photographs early on and later in which they can see, for example, what to expect with scars that are early and scars that are fully healed, so that they don't come back and say, well, Dr. Kayser, you didn't tell me that. I don't want them to do that. I want them to say, you know what, Dr. Kayser, you told me everything you told me came true. It's amazing. I have really come to enjoy patients who have experienced plastic surgery in the past, whose results may not have turned out like they wanted. And to be faced with an opportunity to really restore the results that a patient may have expected to have is a challenge. First of all, you have to deal with the expectations that patients had and objectively evaluate that patient in a realistic way so that you can communicate with them what they truly can expect and what our limitations are. There are some situations that a great result may not be possible. But in many patients, it's not uncommon to say, look, we can do something here. And they have hope, and that's really a challenge. It's encouraging, but it is a challenge. And when they come back and we have improved their results, they love it, and it's awesome. And that's, again, goes back to that win-win situation where we have a happy patient. Absolutely essential. With all the media today, the Hollywood, mommy makeovers, all this type of mindset that patients are inundated with, it really can be overbearing and misleading. The extreme makeover shows really tried to condense into 1 hour what took weeks and weeks to transpire. And I think that's really somewhat skewed what it is that patients come to think about plastic surgery. But the reality is it is still surgery. And although our goal is to, again, provide less and less invasive procedures, such as the Botox and the fillers and concepts in rejuvenation without surgery, we still resort to a mainstay commodity of surgical procedures, and that involves healing. And it's important for patients to understand that there is a time that will be necessary for them to heal. I want them to know they're going to be in good hands. I want them to know that there's no such thing as a stupid question. I want them to know that we're going to be here after they leave. I want them to know they can trust us. I want them to know that what we're doing is safe. This is not something I do out of my office. I operate only at fully accredited and credentialed facilities. I want them to know that not only do I care, but my staff does as well. I want them to know that despite the fact that initially after surgery they may question, why did I do this to myself? It gets better. And that when all is said and done, they're able to look back and say, I would do it all over again. It was a wonderful experience for me. I think that in most circumstances, I really don't have the words to describe that. It's a very moving moment. I think that overall people are grateful. I think they feel like that, they thought this out, that this is a long process that they gave a lot of thought to, and that they're glad that they went through it. But you do have patients that come in that really have had their lives touched and changed. And those are special moments. They really are.